Now, as the name says, their chemical structure contains four cycles. Okay, so tetracycline drugs coming under this group are tetracycline is also a drug, oxytetracycline, chlortetracycline, demiclocycline, doxycycline, and minocycline. Mechanism of action is very simple. You know, again I am revising. We know that tRNA will come and it will get attached to A site. But what tetracycline will do in presence of tetracycline, this tRNA it cannot come and attach to the A site, right? Next, we shall check out the uses of tetracycline, and it can be remembered from the mnemonic tetracycline itself. Okay, so TET is for tetracycline, R is for rickettsial infection. Tetracyclines are drug of choice for all the rickettsial infection. A is for atypical pneumonia. Nowadays, drug of choice for atypical pneumonia are macrolides, but tetracycline can also be used as an alternative. C is for cholera. Tetracyclines are drug of choice for cholera. Y is for Lyme's disease, like tick-borne illness caused by bacterium borreliosis. Tetracycline can use for treating Lyme disease also. Cl is for chlamydial infection, LGV. LGV means lymphogranuloma varianum, which is caused by chlamydia. Now these tetracyclines are drug of choice for this kind of infection. IN means inguinal granuloma. Tetracyclines are again drug of choice for inguinal granuloma. And lastly, E is for epidemics of plague, where again tetracyclines can be used. Okay, so basically tetracyclines, these are drug of choice for rickettsial infection, for cholera, for LGV, that is lymphogranuloma varianum, and also for inguinal granuloma. Okay, in other conditions it can be used as alternatives. Tetracycline are drug of choice means tetracycline group, and for most of these infections the drug of choice is doxycycline. Okay, next we shall check out adverse effects of tetracycline, and it can be remembered from the mnemonic Kapil Dev. Now K means kidney failure. So tetracycline are contraindicated in kidney failure except doxycycline. Why? Because it is excreted in bile. Rest all other tetracycline are excreted via renal route, therefore they are contraindicated. Next, A is for anti-anabolic effect. Tetracycline can produce anti-anabolic effect. Long-term tetracycline use can cause loss of muscle mass. P means phototoxicity. So these tetracycline are phototoxic. It can lead to rash if tetracycline is exposed to sunlight. Here demiclocycline is highest phototoxic. I is for insipidus, that is diabetes insipidus. It can be caused. Tetracycline inhibits release of ADH hormone, therefore diabetes insipidus occurs. Here again demiclocycline have got highest risk of causing diabetes insipidus. L is for liver failure. So tetracycline are also contraindicated in renal failure. D is for dentition and bone problem. Tetracycline can affect the growing teeth and bone, therefore contraindicated in pregnancy and children. E is for expired tetracycline. Tetracycline should not be given after expiry date. Like other drugs, if we give after expiry date, normally it becomes ineffective. But problem with tetracycline is some side effects appears which are normally not present, like for example Fanconi syndrome caused only by expired or outdated tetracycline. Lastly, V means vestibular dysfunction. So tetracycline can produce vestibular dysfunction also, and highest risk is with minocycline. Okay, so these all are adverse effects produced by tetracycline. Now suppose this is a bacteria. Okay, and whenever we give tetracycline, they inhibit the growth of bacteria. So after 2 days, means for 2 days when we give tetracycline, next for 5 days, 1 month, 6 months, for 1 year, and so on, we give tetracycline, and these basically they will inhibit the bacteria. So now these bacteria, they calls for a meeting with all the other bacteria. So what they decided that we will not tolerate this, means tetracycline is coming and killing us, will not tolerate this. So they planned, and what they did, whenever tetracycline comes, they will kick off the tetracycline. Okay, so they have produced a kick. Okay, that means they, because of this kick, now they remove the tetracycline out of the bacteria. So what does it means? It means that resistance has been developed to tetracycline, and the name of this kick is known as efflux pumps. Okay, therefore resistance to tetracycline develops because of efflux pumps. Now we know that bacteria has efflux pumps, and now it is resistant to tetracycline. So now we also become very much intelligent. So what happens? Upon bacteria, whenever tetracycline come, this efflux pump will kick off the bacteria. So now what we have developed? We have developed a cutter. Now we are cutting this leg only, and the name of this cutter is tetracycline. Okay, so mechanism of action and everything of this tetracycline is just like tetracycline, but chemical structure is different. Tetracycline is chemically belonging to a group of drug called as glycycline. Now the special point regarding this tetracycline to remember is it is resistant to efflux pumps. This we know. Next thing is it is very broad spectrum but not effective against pseudomonas. And lastly, it is secreted in bile, therefore safe in renal disease. Okay, so this is all about tetracycline. Next we shall discuss about chloramphenicol.